I think it's a super exciting field. And I think you saw some of the leaders of our field on that panel, looking at gene therapy for hypertrophic cardiomyopathy and for heart failure, as we heard about from our colleagues at Tenaya. We're seeing cell therapy for acute myocardial infarction and, atheresis. Cell therapy, at Novo Nordisk for heart failure, cell therapy with Avery Therapeutics as well. So all of them, really describe some of their, and then of course, Blue Rock was describing some of their cell therapy and their, unique products. So I think there's a lot of excitement, a lot of new areas. I think some of the really cool things that we're seeing as well are gene editing as well as gene therapy. And I think that's going to really be very exciting for the future. I think this is a super, innovative field. I think it's a cutting edge of cardiovascular medicine. And there's a lot of promise here. A lot of challenge, but a lot of promise. And I think that because of that, as we learn more and more, we're going to kind of stand on the shoulders of the people who've kind of, pioneered this field ahead of us. But I think as we move forward, there's lots of also, in addition to the assets themselves, there's also really exciting ways that we can deliver these studies. So things like, decentralized trial approaches, really, as your sample sizes get larger, using really novel ways to recruit patients, leveraging biomarker repositories and labs to be able to find patients, and even using things like AI and ML to really understand, here's sort of the phenotype of a patient who maybe responded to a cell or gene therapy in the past. Let's see if we can figure out, based on that, who the right phenotypes in the future might be to really target for these therapies. So I think there's a lot of really cool things that we can learn as a lot of really interesting things that we've learned and things that we can use from what we've learned to apply to advance the field moving forward.